Hello, my name is Beyonce Palma Mendoza, and today I'll be presenting on pneumonia. Pneumonia is a common respiratory infection, but it can range from a mild illness to a serious and potential life threatening condition. It is especially important to understand because certain groups of people, such as the elderly, young children, and people with weaker immune systems, can be severely impacted by this illness. And so during this presentation, I'll explain pneumonia, the different ways it can be classified, the causes, the comorbidities, the symptoms and diagnosis, the treatment and management outcomes, and some interesting facts and how to prevent it. So, what is pneumonia? Pneumonia is a lower respiratory tract infection that can cause inflammation of the alveoli in one or both lungs. Um, the Normally the alveoli is filled with air when we breathe it in. This is where gas exchange occurs, and so then the oxygen moves from the alveoli into the bloodstream, while carbon dioxide moves from the bloodstream back into the lungs so it can be exhaled. But when a person has pneumonia, the alveoli can become inflamed and can fill up with fluid and pus. Um, and this makes it more difficult for oxygen to move around the bloodstream because it's just making it harder to breathe, harder for everything to move because it's all inflamed and not in its normal shape, cir- size. A person can experience symptoms such as shortness of breath, difficulty breathing, and low oxygen levels. And this inflammation and fluid buildup are what make pneumonia different from a simpler upper respiratory infection, such as a cold, because pneumonia affects the lungs and it interferes with oxygen exchange. Um, it can be more serious, especially in people that have a weaker immune system. So now we have three different types of classifications that pneumonia can fall into. Um, so the first classification is location. The first classification of location can be community acquired pneumonia, or otherwise known as CAP, and it could be obtained through the community through someone that has pneumonia and that is spreading it towards others, and it happens outside of a healthcare setting. And then the second one is hospital acquired pneumonia, or HAP, and it's acquired by staying in the hospital for longer periods of time and for more than 48 hours. So that can lead to someone contracting pneumonia. And then the second classification is immune status. So if you're immunocompetent, it means that your immune system can fight against infections, diseases, and all of that. But if you're immunocompromised, it means that your immune system doesn't work and it can't fight off infections or bacteria, which is a very risky thing. And then the last classification is microbiology, and it can be caused by viral, bacterial, or fungal infections, and these are the most rarest. No, sorry, fungal infections are the more rarest kinds to be found because they're just rare. Um, so they can be identified based on like types of testing, so like blood testing and all that, to see which of the three you have, if it's a viral, bacterial, or fungal pneumonia. And then the next one is causes and risk factors of pneumonia. So the causes can be, as I said before, bacterial infections such as streptococcus pneumoniae, and then viral infections such as the flu or COVID, and fungal infections are more rare and they're not really as common. So it just affects mostly people that have weaker immune systems or can't fight against pathogens. And risk factors can be being either very young or very older age. It could be smoking, chronic illnesses such as asthma, COPD, diabetes, cancer, a weakened immune system, and longer hospital stays. So it's best to get it treated before or at an early stage. And then the next is comorbidities, which comorbidities are other medical conditions that can affect the body alongside pneumonia and increase the risk of illness and complications. So one of them is COPD, or chronic obstructive pulmonary disease, and it damages the airway, so it could um, be a little bit more harder to clear up the infection since the alveoli is getting inflamed, and so is like the damaged airway, so it's going to be a little bit more harder to bring down the inflammation. And so then asthma is another one. Inflamed airways can increase diffi- difficulty in breathing, especially during pneumonia, because pneumonia, one of the symptoms is difficulty breathing. So on top of that, having asthma, that's very unfortunate. So then there's diabetes, which a high blood sugar can weaken the immune system and it can reduce the ability to fight infections. And then we have renal impairment, which can reduce the kidney's functions and weaken the immune system, and that can lead to a slower recovery. So, next we have symptoms and diagnosis. So, the common symptoms are usually a persistent cough with mucus or phlegm and a high fever, such as like 104 around there, and chills. And other key symptoms can be also shortness of breath, sharp chest pains, fatigue, confusion, low oxygen levels, because, as said before, the oxygen is not getting towards the rest of the body, is not circulating in the bloodstream. So that can lead to lower oxygen and not enough oxygen going to the other body parts. And it can be diagnosed through a chest x-ray to see if there's lung inflammation and or fluid in the lungs, blood test to see which infection it can be, um, sputum culture to detect the specific pathogen, pulse oximetry to measure the blood oxygen level to see if it has a low oxygen or a high oxygen level, and also just hearing the lungs to see if there's anything abnormal about them. So then treatment and management. So medical treatments are antibiotics, and they usually last 5 to 7 days. And then there's also antiviral medications that can be used for like flu related pneumonia type. Then antifungal, which are for the rare fungal cases. As I said before, they're not that popular, if I can say. So they're for immunocompromised patients, or like patients that have a weaker immune system that can't fight back the diseases. And then a supportive care or management can be oxygen therapy to maintain the blood oxygen levels and to keep them from being unbalanced, to get them balanced to it. They have low oxygen levels to get them higher, to have them equal. And then IV to be prevent dehydration, because if you have a renal illness, that can also lead to that can affect the kidneys, which help with hydration, so that can lead to dehydration. um, Fever can be managed with analgesics, and then if it is a severe case of pneumonia, you can be hospitalized or be taken into the intensive care unit. And then we have outcomes. So with an early diagnosis, healthy people can recuperate between 1 to 3 weeks. Some complications that can happen are cardiac complications such as heart failure, acute coronary syndrome, arrhythm- arrhythmias, mortality such as death, and respiratory failure. Um, and then a good prognosis is that mm most healthy adults can recuperate with just the treatment that they're given. And people that are at higher risk are older adults, younger children, infants, people with illnesses, which can lead to longer recoveries because the immune system is also getting attacked. And then something interesting that I learned about pneumonia is that it's the fifth leading cause of death, because it's part of the upper respiratory diseases, and the upper respiratory diseases are the fifth leading cause of death. And then vaccines are also a good way to reduce the risk of getting pneumonia. And then smoking also damages the lungs, so it also increases the risk of infection. And to conclude, um, vaccine prevention, vaccines, the pneumococcal and influenza vaccines, and then good hygiene, always washing your hands, and having good respiratory etiquette. Don't be sneezing, coughing everywhere. Cover your mouth when you're doing that. Avoid smoking, um, and to manage and control your chronic conditions, though they may not be controllable, but at least be where you have control over what can happen, and early treatment of respiratory infections. And that's it. Thank you. And these are my citations.